what we do in that surgical procedure,
Yeah.
just so they can get an idea?
What we do in that, depending on whether it is ovarian endometriosis or extra ovarian, like I said,
Right.
it can be anywhere there. So when we go inside with the telescope, we can have a panoramic view of everything, wherever the disease is, wherever on the surface of the peritoneum, wherever it is. So if it's only surface endometriosis,
Right.
we just have to fulgurate or excise that. But if it's a deep infiltrating, we have to excise every bit of endometriosis what we see. The most common site being the ectovaginal septum, that is between the bubble loop and the uterus. Okay, so that is the reason they have so much of pain during passing motion. I mean, the
Right.
whole quality of life, even regular natural calls are painful. Sometimes when they have a bladder endometriosis, they start bleeding from the urine whenever and they'll have lots of pain during passing the urine. I mean, it's a terrible disease for a woman to have. So wherever it is, we do the excision is the thing. If it's extra ovarian, we go on to the eccentric surgeries where, elaboratively, if it is bladder is involved, we remove some amount of bladder along with it. With the bubble, we remove the shaving part of it, or remove the part where it is, and then do reanastomosis.
Right.
If it's near the ureter and pressing on the ureter, we do ureterolysis, where we separate the ureter and keep it safely away from the disease. And there is something, most of the time it is the broad ligament, but we call it as the layer which lines the complete uterus and everything, which is completely studded with that, which we will not see. So in laparoscopy, we have a green filter which we see where all the implants will be there, and we'll be completely excising it. But when it comes to the ovary, we always look at how to save the ovarian function. It's always like this, balancing the ovarian function, the natural hormones of the woman versus removing the thing.
Right.
So when it comes to infertility, what we do is we go to the cyst and we just remove the whole cyst wall. Can we remove the whole thing? Sometimes it might become very difficult to remove the whole thing. Then 90% of the cyst wall we will be removing by using laparoscopy, and then the bit which is not able to remove, then we burn it off, at least coagulate it. Or nowadays we have better techniques like instilling vasopressin into the layer so that hydrodissection and the whole cyst wall comes out.
Right.
So whatever we do, we put it into endobag and then remove it, because again if that tissue touches any skin, it can implant there and cause again the scar endometriosis.
Right.
After cesarean also we do have scar endometriosis, Bhavani,
Yes,
that's what I'm saying.
Yes.
So even when we remove the baby and the endometrium touches the skin,
We
they
can
can
still
have
end up,
this.
yeah.
So this is the thing, like if the patient has a tendency to develop, it's just a waiting for an opportunity to come. That's it. It will not leave it. One cell can become like, totipotent cell, and then the chest.
Similar to cancer, but not cancer.
Yes, like I said, so it is much more easier for me to explain to the patient when I say that it is not cancer, but it is like cancer. So you be clear that what exactly are you looking at? Is it for the pain or the pregnancy? And this is what you might get it back. So how we have to see that after delivery, you don't get it back. So I think it's a counseling which makes a huge difference in it, and the open-mindedness of the patient to understand rather than going into depression because of just thinking that I have a disease. Why me? Why should I get?
True.
And that is the first common thing. First thing which we see with the patient is why me? I say you are not the only one. We have so much of the incidents nowadays.
Is it safe to say that it's a good relationship to be had between the patients and the doctors to understand endometriosis?
It is very important. It is very important. I always tell a girl, you make a closest friend after your mom would be your gynecologist, which you have to choose from your things, because it's a lifetime friend for you. Whatever happens when it comes to your diseases or the deliveries or anything, one person you should trust
is your
gynecologist.